Your ears can ring at 4 in the morning for a reason that has almost nothing to do with the thing every doctor blames first. And by the time you finish listening to me, you may realize that the quiet, high-pitched whine you've been ignoring for months is not just your age and not just tired blood vessels. It is a signal. A biological alarm coming from a structure smaller than a fingernail, buried deep inside your skull. And it has been trying to get your attention for a very long time. My name is Dr. James Robert Calloway. 30 years I've spent in internal medicine, and my patients, the ones who've been with me the longest, they just call me Dr. J. I've sat across from more people over the age of 70 complaining about ringing ears and spinning heads than I could ever count. And I'll tell you something right now, something that took me the better part of 2 decades to fully understand. 90% of the time, when a man or a woman past 70 walks in and says, "Doctor, my ears are ringing," and the room tilts when I stand up, the answer they get is one word: vessels. It's your vessels. It's circulation. It's age. Take it easy. And that answer is a trap. Listen to me carefully, because this is the whole reason I'm making this. That answer is not just incomplete. It's the kind of incomplete that lets the real problem grow quietly in the background while everyone congratulates themselves on a tidy explanation. So here's what I want to know, and here's what I promise you we're going to unravel together, piece by piece, in the next little while. First question: why does an ordinary blood pressure pill, the kind that half of everyone over 70 has sitting in a cabinet right now, why can that pill quietly turn a faint ringing into something that follows you into your sleep? Second question: what on earth does the salt in your kitchen have to do with a fluid deep inside your inner ear, and why does that connection get worse precisely after 70? And third, the one that really matters: why do so many good, competent doctors reach for the word vessels and stop there when the actual machinery of balance and hearing is sitting one layer deeper, waiting to be examined? I give you my word, by the end of this, you'll have an answer to every single one of those. Not vague reassurance. Real physiology, in plain language, the way I'd explain it to my own father if he were sitting in front of me. And if protecting the years you have left matters to you, if you want to understand your own body instead of being handed one tired word, then subscribe and tap that like button now, because what's coming next is the part almost nobody explains out loud. Now let me take you somewhere. Not into a textbook, into an exam room. A few years back, a woman came to see me, 73 years old, sharp as a tack, ran her own bookshop for 40 years. She sat down, folded her hands, and said, "Dr. J, 3 cardiologists have told me my heart is fine and my arteries are fine. So why does my left ear sound like a kettle that never stops boiling? And why do I have to grab the door frame every morning when I get out of bed?" And she looked at me, really looked at me, the way people do when they're one dismissal away from giving up on medicine entirely. I didn't say vessels. I did something almost no one had done for her. I asked her to tilt her head, just tilt it, slowly, to the side. And her eyes started to flicker, this tiny rhythmic jump side to side. There it was. That flicker has a name, and it's not coming from any artery, it's coming from the inner ear, and in that one small movement, half of her mystery cracked open. So let me build this for you properly, because you can't understand the danger until you understand the machine. Deep inside the bone of your skull, on each side, past the eardrum, past the tiny bones, there's a structure. The old anatomists called it the labyrinth, and honestly the name is perfect because it's a maze of curved tunnels filled with fluid. This is the inner ear. And it does 2 jobs at once, 2 jobs that most people never realize are housed in the same tiny place. Job 1. Hearing. There's a spiral organ in there, coiled like a snail shell, lined with thousands upon thousands of microscopic hair cells. Job 2. Balance. 3 little loops arranged at angles to each other, plus 2 small pouches, and those detect every tilt, every turn, every time you nod or shake your head. Here's the nuance, and this is the first thing nobody tells you in the office. Hearing and balance share the same fluid, the same plumbing. So when something goes wrong with the fluid, the pressure of it, the chemistry of it, the volume of it, you don't get just ringing and you don't get just dizziness. You very often get both, together, at the same time. And when a person over 70 walks in with both, the two symptoms are not a coincidence, and they are not two separate problems. They are two alarms wired to the same broken box. Now stay with me, because here's where age changes everything. Inside those tiny pouches I mentioned, the ones that sense whether your head is tilted or level, there are crystals, real crystals. Tiny grains of calcium carbonate, and doctors call them otoliths, which just means ear stones. When you're young, these crystals sit exactly where they belong, anchored in a jelly-like layer, and they shift precisely as your head moves, telling your brain you're upright or you're leaning. Beautiful system. Elegant. Reliable. But watch what time does. As the decades pass, and this accelerates sharply after 60, then again after 70, that anchoring jelly weakens. The crystals loosen, and some of them break free. They drift out of the pouch where they belong and float into those curved loops, the balance canals, where they were never, ever supposed to be. And now, every time you turn your head, or roll over in bed, or bend down to tie your shoe, those loose crystals tumble through the fluid like gravel rolling down a pipe. The canal screams a false signal to your brain. Your brain hears, "You're spinning," but your eyes see a still room. And that contradiction, that mismatch between what the inner ear says and what the eyes say, that is vertigo. That is the spinning. That is the doorframe grabbing at 6 in the morning. And here's the part that made my bookshop patient cry with relief. It has nothing to do with her arteries. Nothing. You could have the cleanest blood vessels in the state and still have loose crystals turning your mornings into a carnival ride. But, and this is the biological timer I want you to hold on to, while you're sitting there listening to me, in the inner ear of a person over 70, that jelly layer is thinning by the day. And the chemistry of the fluid around it depends on something happening in an organ nowhere near your head. It depends on your kidneys. And the moment we bring the kidneys into this, we have to talk about the pills. Because there is a very common medication that reaches straight into that chemistry and stirs the pot, and most people taking it have no idea their ears are part of the equation. Now, before I get there, I want to be honest with you the way I'm honest with my own patients. Nothing I tell you today replaces the doctor who actually examines you. Keep that in your pocket. But also understand this. You can't ask the right question if nobody ever handed you the map. I'm handing you the map. So let's talk about that ringing on its own for a moment, because people misunderstand it completely. The ringing. The medical word is tinnitus. Most folks think it's a sound coming from outside or from the ear making noise. It isn't. Listen to me closely. In the vast majority of cases, that sound is not out there in the world, and it's not even really in your ear. It's your brain. Those thousands of tiny hair cells I described, the ones in the snail-shaped hearing organ, as we age, and especially past 70, some of them wear down and stop sending signals. And here's the strange, almost eerie part. When the brain stops receiving signal from a certain pitch, it doesn't just go quiet. It does the opposite. It turns up its own internal volume, straining to hear, like a person cupping a hand to their ear in a silent room. And that straining, that turned-up gain in the brain's hearing centers, that's the wine. That's the kettle that never boils over. Your brain is generating a sound to fill a silence. Think about what that means. The ringing isn't damage happening right now necessarily. It's your brain's reaction to a loss that already happened, which is exactly why chasing it with the wrong explanation, it's your vessels. sends everyone looking in the wrong direction for years. I remember a man, 78, retired machinist, worked around loud engines his whole life. He came in convinced he was going to lose his mind from the ringing. His previous doctor had put him through scan after scan of his neck arteries, all clean. And nobody had asked him the one thing I asked in the first 2 minutes. What medications are you on? And when exactly did the ringing get louder? I remember a man, 78, retired machinist, worked around loud engines his whole life. He came in convinced he was going to lose his mind from the ringing. His previous doctor had put him through scan after scan of his neck arteries, all clean. And nobody had asked him the one thing I asked in the first 2 minutes. What medications are you on? And when exactly did the ringing get louder? Because here's a hook I want you to sit with before we go further. Everyone believes that if their heart tests come back clean, the ear problem must be separate, a whole different issue in a whole different place. That belief feels like relief, but it's a false relief, and it's the most expensive mistake I see, because the very pill protecting your heart may be the exact thing whispering into your inner ear every single night, and the connection runs straight through an organ you've never once suspected. I'll show you precisely how, and it's not what you think. So let's follow the thread from the heart pill all the way into the ear, because this is the connection that gets skipped, and once you see it, you'll never unsee it. Start with the kidneys. I know, we're supposed to be talking about ears, and now I'm dragging you down to organs sitting near the small of your back. Stay with me, because this is the hidden wiring. Your kidneys are the master controllers of your body's salt and water. Every second of every day, they decide how much sodium to keep, how much potassium to hold, how much fluid to release. And the fluid inside your inner ear, that precious fluid bathing the balance canals and the hearing cells, its chemistry is a direct downstream reflection of what your kidneys are doing. When the sodium and potassium balance in your blood drifts, the balance inside that tiny labyrinth drifts right along with it. The ear is not an island, it's connected to the whole ocean. Now bring in the pill. Lisinopril, one of the most prescribed blood pressure medications on Earth, and for good reason. It's a solid drug. It protects hearts. It protects kidneys in the right patient. I've prescribed it thousands of times. I'm not here to frighten you off your medication, and I want to be crystal clear about that. Because the last thing I want is someone flushing their pills down the sink after listening to me. Do not do that, ever. But I am here to tell you the nuance nobody mentions when they hand you that little white tablet. Lisinopril belongs to a family called ACE inhibitors. What it does, in plain terms, is block a chemical signal that normally tells your body to hold on to sodium and let go of potassium. So the drug flips that. It lets a little more sodium leave, and it tells the body to hold on to more potassium. For most younger people, the body shrugs and adjusts. But here's the trap, and it's an age trap. After 70, your kidneys are slower. They're less nimble. They don't fine-tune the way they did at 40. So the same dose that was gentle at 55 can nudge your potassium up higher than it should go, and can shift your sodium in ways your body used to buffer effortlessly and now simply can't. And what sits at the receiving end of every one of those shifts? That inner ear fluid. When the electrolyte chemistry wobbles, the delicate hair cells, already worn from decades of living, misfire. The brain's volume knob, the one I told you about, cranks up, and the ringing gets louder. Not because your ears are failing overnight, but because the internal sea they float in just got choppier. There's more, and this is the part that makes patients slap their forehead. Lisinopril has a signature side effect that almost everyone on it knows about: the dry, nagging, tickle-in-the-throat cough. Roughly 1 in 10 people on an ACE inhibitor gets it, sometimes higher in the folks I've treated. Everyone treats that cough as a throat problem, a nuisance, something to clear your throat over. But that persistent cough is a fingerprint. It's a sign that the drug is actively affecting the tissues and the chemical messengers throughout your body. The very same class of messengers, called kinins, that also play a role in fluid regulation and inflammation. When I see an older patient with a new dry cough and worsening ear ringing on the same medication, I don't think coincidence. I think same source, two windows. Let me put a real face on it. My machinist, the 78-year-old, his previous prescription had been switched to lisinopril about 4 months before the ringing became unbearable. Nobody connected the two. Why would they? The cough clinic looked at his throat. The ear specialist looked at his ear. The cardiologist looked at his heart. Each one saw their window. Not one of them stepped back to see the whole house. That's the disease of modern medicine, and I say that as someone who's been part of it for 30 years. We've gotten so specialized that we've forgotten the body is one connected thing. Now, biological timer, hold on to this one. Right now, as you sit there, if you're on a medication like this and you've noticed a whisper of a dry cough, there's a quiet electrolyte conversation happening between your kidneys and your bloodstream, and your inner ear is eavesdropping on every word of it. You won't feel the potassium creep. You won't feel the sodium shift. The first thing you'll notice is the ringing getting a little louder or the room tilting a half second longer when you stand. Those aren't random. Those are the readout. Let me widen the lens, because lisinopril isn't the only actor, and I don't want you thinking one drug is the villain. It isn't. It's a category effect. Take losartan. Different family. It's what we call an ARB. It does a similar job to lisinopril but works one step down the same chemical chain, and it usually spares people that cough. Good drug. But it plays the same game with potassium, and in the slower kidneys of someone past 75, it can push that potassium north just the same. Same downstream effect on the ear's chemistry. Different door, same room. And then there's metoprolol. Now this one's a different animal entirely, and I want you to pay close attention because the mechanism here is sneaky in its own way. Metoprolol is a beta blocker. It slows the heart down. It softens the force of each beat. Wonderful for certain hearts. But listen, when you slow the pump, you can, in some older people, subtly reduce the vigor of blood flow to the tiniest, most fragile vascular beds in the body. And where is one of the most fragile, most flow-dependent tissues in your entire body? That snail-shaped hearing organ in your inner ear. It has almost no backup blood supply. It runs on a single delicate stream. So in a susceptible person over 70, a heart running quieter and gentler can mean an inner ear running just slightly hungrier for oxygen, and a hungry inner ear rings, and a hungry inner ear gets dizzy. There's your second mechanism. So now you see it. 3 of the most common pills in every older person's cabinet, 3 completely different mechanisms, all converging on the same tiny target. One shifts the electrolytes. One does the same from a different angle. One quiets the blood flow. And the target, always the target, is that little labyrinth of fluid and hair cells that governs whether you can hear the birds and stand up without the world sliding sideways. Here's the conspiracy of silence, and I'm going to say it plainly because someone has to. This connection between routine cardiovascular medications and inner ear symptoms in the elderly is not a secret in the medical literature. It's documented. I've read the reports. I've pulled them from the archives myself when I got suspicious about my own patients, but it rarely, almost never, makes it into the 4-minute conversation you get in an exam room. Why? Not malice. Time. The appointment is short. The prescription needs renewing. The blood pressure number looks good on the screen. And the ringing in your ear? That gets filed under age, because age is a word that closes a chart quickly and doesn't require a follow-up. That's the trap. Not a villain in a white coat. A system that rewards speed over connection. Let me tell you what I actually do differently, because I think it'll change how you talk to your own doctor. When an older patient comes in with new or worsening ringing and dizziness, the first thing I do, before any fancy scan, is lay out every single medication on the table, literally, all the bottles, and I ask one question: what changed and when? 9 times out of 10 in my practice, there's a timeline. A dose went up. A pill got swapped. Something shifted 3 or 4 months before the ears got loud. That timeline is worth more than $1,000 scan, and it costs nothing but curiosity. Now here's where I have to catch you, because I can feel the relief forming in your mind. You're thinking, so it's just my pills. I'll ask my doctor to adjust them, and the ringing will stop. And I understand why that feels good. It's a clean answer. But it's another false floor, and I won't let you rest on it. Because the medication is only half the machine. The other half, the half that explains why your symptoms are so much worse at 4 in the morning than at 4 in the afternoon, has nothing to do with any drug at all. It has to do with the position of your head while you sleep, and with a river of fluid that moves inside your skull only when you lie down. And what I'm about to explain about that nighttime river is the single most overlooked cause of morning ringing and morning vertigo in people over 70 DAS, and it's happening to you tonight whether you believe me or not. Why 4 in the morning? Why does the ringing swell in the dark? And why is the worst dizziness of your whole day waiting for you the moment you swing your legs out of bed? People blame the quiet. It's just that the house is silent, so I hear it more. And sure, silence plays a small part. But that's the surface answer, and by now you know how I feel about surface answers. The real reason is a river of fluid that moves through your skull on a schedule, and that schedule turns against you when you lie flat. Let me build it for you. During the day, when you're upright, gravity is your friend. Fluids drain downward, away from your head. Pressure inside the skull stays low and steady. The inner ear fluid, that precious sea we keep coming back to, sits at a comfortable pressure. But the moment you lie down, everything changes. Gravity stops pulling fluid away from your head. Blood pools differently. And the fluid pressure inside your skull and inside that little labyrinth slowly, quietly rises through the night. Hour by hour as you sleep, the pressure in your inner ear climbs. And a labyrinth under higher pressure is a labyrinth that rings louder and balances worse. That's your 4 a.m. That's why the kettle is loudest in the dark. It isn't the silence, it's the pressure. Everyone treats ringing and dizziness as two problems. Even good doctors do. They send you to one specialist for the ears that ring, and if you're lucky, another for the head that spins. But I told you at the very beginning, hearing and balance live in the same fluid, in the same tiny labyrinth. So think it through with me. If the fluid pressure in that labyrinth rises at night, from lying flat, from the salty dinner, from kidneys nudged by a pill, then that single rise in pressure presses on both the hearing side and the balance side at the exact same moment. One cause, two symptoms. That is why they arrive together at 4 in the morning. That is why they worsen on the same nights. They were never two problems. They were always one pressure, pushing on two doors of the same room. And here's the powerful part, the part that reframes everything. When you understand it as one pressure problem instead of two separate mysteries, the whole thing becomes something you can actually influence. You can't easily unage your hair cells. But pressure? Pressure you can move. Lower the evening salt, and the nighttime pressure rise flattens. Raise the head of the bed just a few inches, not a stack of pillows that kinks your neck, but the whole head of the bed tilted, and gravity keeps helping drain fluid even while you sleep, so the pressure never climbs as high. Two changes, no cost, and they strike at the actual mechanism instead of the label on your chart. Now the crystals, the loose ear stones, those aren't a pressure problem. They're a mechanical one, and mechanical problems have mechanical fixes. There are specific, gentle, doctor-guided head positioning maneuvers designed to roll those wayward crystals back out of the balance canal and into the pouch where they belong. I've watched a person walk in gripping the wall, terrified, and walk out 20 minutes later steady after one properly done maneuver. It looks like magic. It isn't magic. There's no magic in any of this, only physiology. It's just gravity, used deliberately to move gravel out of a pipe. But, and hear me, do not go rolling your own head around based on a video. In an older neck with older arteries, That's not something to improvise. This is exactly the conversation to have with your doctor, and now you'll know the words. Could my dizziness be positional, from the inner ear, and could we try a repositioning maneuver? So let me hand you the practical map, cleanly, the way I'd write it for my own father. First, take every medication bottle you own and put them on the table and ask your doctor one question. What changed, and when, before my ears got louder? Bring the timeline. That timeline is your most valuable tool, and it's free. Second, never ever stop or change a heart or blood pressure medication on your own, not one dose. What you do instead is bring the connection into the room. Say the words, "I've noticed ringing and dizziness. Could my medication be contributing, and is there an alternative worth considering?" A good doctor will respect that question. It's the right question. Third, look at your evening salt with fresh eyes. Not the salt shaker only. The hidden salt, the canned soup, the deli meat, the frozen dinner. Cut the evening load, drink a full glass of water when you wake, and give it 2 weeks. Fourth, raise the head of your bed, gently, and notice which side you sleep on. If one side brings a savage morning and the other a mild one, tell your doctor. You've just handed them a diagnosis. Fifth, and maybe most important, do not let fear shrink your world. Remember the domino. The more you freeze up and move carefully to dodge the dizziness, the more your brain detrains and the worse it gets. Under proper guidance, gentle, deliberate movement is often the medicine, not the enemy. Now let me bring you back to where we started, back to that woman in the exam room. 73, the bookshop, 3 clean heart tests, and a left ear that sounded like a kettle that never stopped boiling. You remember I asked her to tilt her head, and her eyes flickered. Here's what happened to her. It wasn't her vessels. Every cardiologist had been right about that, and wrong to stop there. She had loose crystals in one canal. She slept on that exact side. She ate a salty supper most nights, and she was on a blood pressure pill that had been quietly nudging her kidneys for a year. Every window, one small thing. Put together, the convergence. We did the maneuver for the crystals. She raised the head of her bed. She halved the evening salt. And her doctor, when she brought the timeline, adjusted her medication thoughtfully. The kettle didn't vanish overnight. But within a month, she told me she could get out of bed in the morning without reaching for the doorframe, and the ringing had faded from a scream to a murmur she could ignore. She got her mornings back. At 73, that's not a small thing. That's the whole thing. So when you hear that ringing at 4 in the morning, and now you know why it's 4 in the morning, why it's loudest in the dark, why the room tilts when you rise, I want you to understand what it actually is. It is not just your age. It is not just your vessels. It is a signal from the smallest, most elegant machine in your body, telling you that the sea inside it has grown choppy, and that the pressure, the salt, the crystals, and maybe a pill have all quietly converged. It is not a sentence. It is an invitation to ask the right question, the one nobody handed you until today. And everything I've told you, every mechanism, every nuance, none of it replaces the doctor who examines you with their own hands. Take this map into that room. Ask the questions. Bring the timeline. That's how you protect not just your hearing and your balance, but the independence that depends on them. Because the goal was never really about the ringing. It was about the morning you get out of bed, steady, and walk into your day on your own 2 feet, for as many years as you possibly can. That's the whole story. And now, you're the one who won't miss it.